Have you been able to get vaccinated, to get your shot? If so, you are one of the lucky ones, and also one of the older ones, 65 or above, or a medical professional. The governor made seniors his top COVID priority after those frontline medical workers, but tens of thousands of seniors are still waiting for their shots, along with millions of younger Floridians. It's going to be months before many of them do get vaccinated. The vaccine rollout has been rocky. Less than a quarter of the more than 1 million doses sent to Florida have been administered. So what is the holdup here? Why has the vaccine rollout been so chaotic, so disorganized? The state agency in charge of the rollout is the Division of Emergency Services. Its director is Jared Moskowitz, a former state representative from Coral Springs, joins us now via Skype from Parkland. Jared, good morning. Thanks for being with us.
Good morning, Michael. Thank you.
Great to have you. Jared, very simply, why has the vaccine rollout been so rocky?
Well, I mean, look, there's a couple of reasons why the start has been, slightly mediocre. One is obviously there's not great visibility on when, the week by week delivery schedules in the Tiberius system that the federal government gives you. So it's tough to do long range planning when you're only getting a 7-day, look and when the vaccine is coming. Also, there's a lot of hesitancy, unfortunately, with a lot of providers on the second shot, because again, we don't have a really good look on when that second shot is coming. Even though the first delivery of the second shot did arrive, a lot of providers are hesitant to get that vaccine on the street, but we're working with them. This is a decentralized effort. It's part of the mass vaccination plan, not just here in the state of Florida, but around the nation. Healthcare is delivered at the local level. So you're talking about hospitals, county health departments, pharmacies. You're talking about thousands of different providers. Healthcare is not delivered at the state level. So this vaccine is going to be done with folks on the ground at the local level. So look, our job at the division is to assess what plans have gone well and what plans have not gone well. Clearly making people wait in line is not a good plan. So look, the division is going to be standing up this week to be taking an extremely much more active role, the governor's direction, to assist these county health departments, to assist the hospitals where they need it.
Yeah. Well, we understand there are a lot of moving parts. It's a huge, complex process to get millions of shots out to the hospitals, to the medical people, and to get the shots into the arms of people. But, the question, Jared, I keep hearing over and over, emails, people who stop me at the supermarket, I still go to the supermarket, is, when and how do I get a shot? I just don't know. Nobody is telling me. So when you hear that question, what do you say?
Well, Michael, when you go to the supermarket, obviously, thank you for wearing a mask. I appreciate that. Look, what we say to people right now is, and what Dr. Fauci has said, is that this is going to take a long period of time. It's going to take a year to really get to that community immunity. The governor has prioritized folks in our long-term care facilities since day one, so that continues to be the mission. The federal pharmacy program, has not been going at the speed that we would like. So, the division will be assisting where we can. Obviously turning on the 65 and older program, which was slightly different what the CDC recommended. Obviously, we did long-term care facilities. We started with that, and we started with hospital workers like the CDC recommended. So that really was the first week. Remember, we're only in the third week of the roll-up so far. We've done about 250,000 shots in arms to date. But, with 65 and older being one of the first states to turn that on, because the governor wants to make sure that people who are most susceptible, most likely to wind up in the hospital, most likely to tax the healthcare system. Obviously, we have 4 million Floridians that fit into that category, and we don't have enough vaccines. So there is a supply and demand issue. But Look, when you're dealing with 67 different county health departments and 300 hospitals, you're dealing with different reservation systems, different leaders, different instructions, different interpretations. So it isn't like testing or PPE, which was a completely state-led mission. And so, there's going to be varying degrees. People, look, I know asking them to be patient when we see the light at the end of the tunnel, but look, it's going to get better every single solitary day. We're helping to build a vaccination army, if you will, here at the division that will help deploy out at the local level, because we really want to get that throughput up, to make sure we're doing more shots per day.
Yeah. Well, we know and have reported, of course, that I guess last week you, the governor, designated Broward and Pinellas County long-term care facilities to have strike teams go out and administer the vaccine. And that's great. But what about, I mean, Florida has what, close to 500,000 people in various long-term care facilities around the state. When are they going to get the vaccine?
Yeah, Michael. So there's 4,000 long-term care facilities, and we know that because the division went into all of them and tested everybody. We tested 1.5 million people in those facilities within 90 days. So right now, the federal pharmacy program, the federal government is the one handling those long-term care facilities. The governor wanted us to do Broward and Pinellas because he wanted us to get ahead of the federal pharmacy program and see how it goes. So far it's not going at the speed that we would like. And so I think you're going to see the division, try to assist the federal pharmacy program to go around the state to go into those facilities. We were able to do all the facilities, the skilled nursing facilities in both Broward and Pinellas County in 5 days. And so, I think that, the federal pharmacy program should be able to give everyone the first shot, in my opinion, in 3 weeks. And it doesn't seem to be that is going at the speed. We're not a party to that contract. So unfortunately, the sharing of the information is not what we would like. So the state's going to be examining the feasibility to assist the federal pharmacy partners in getting more shots in arms in the long-term care facilities, because there's no doubt that we must get into those facilities in the coming days and in the coming weeks. Yeah. That's got to be the priority. We've talked to the partners about that. We've made sure that they understand the importance of it. But look, if they don't perform, then we'll wind up doing it for them.
Right. Jared, tell us about the future supply of vaccine. As you say, it's a supply and demand problem. The federal government sends the state the vaccines. Now, what are you scheduled to get? What numbers do you expect of both the Moderna and the Pfizer vaccine in, the next week or so?
Right. So, look, we got 250,000 doses last week. I expect a similar amount of doses this week. And then I don't know anything else. And so that is kind of what the problem is with the system at the moment. Is it's tough to, people keep asking me, what am I going to get in 2 weeks? What am I getting in 3 weeks? And the truth is, I don't even know what the state is going to receive. And so we have to allocate this on a week-to-week basis. We can't allocate it with, future long-term planning because it's just not available in Tiberias. And like I said before, the second shot, we know about a week before when that second shot is going to come. And it did come for the Pfizer 5. So that's obviously good news. But again, tough to do planning because everyone wants to know when it's arriving, and we can't tell them because the federal government system doesn't give us that visibility. There are going to be pods opening up all over the state. And just, in South Florida, 10 pods are going to be opening in Broward, 3 in Dade, 3 in Palm Beach, in the next week or so. The state's going to be, looking at all of our testing sites and converting a bunch of those into vaccine sites. And so more and more will pop up. But at the end of the day, our throughput will be impacted by a couple of things. One will be how much vaccine we receive, and obviously how many people we have doing shots in arms. What we can do here at the state is we can increase the throughput by putting more people on the street to do shots. Obviously, we cannot increase the amount of vaccine. That's up to the federal government.
Right. Well, we know you are doing your best. We hope and are looking for assurances that this rollout is going to smooth out a little bit. Is it going to sort of get better as we go along here, say the next week or so, do you think?
Yeah, Michael, listen, it's going to get better. Just like when testing first started, the division had to go out and procure COVID test kits on the private market because none were available. And then there were no swabs available. We had to go procure that. Then there was, we had PPE issues. Obviously, we had to go do that. We got 80 million masks out, 15 million in our long-term care facilities. So every time there's kind of like a new facet, since, the states are pretty much on their own, we have to go out, work with our local partners and do it on our own. And sometimes, you hit a couple bumps, some growing pains as you start something new. And so this will smooth itself out. Look, I'm as frustrated as everybody else. I want to get to the end of this nightmare as well, to get back to all of our lives, let the economy flourish. There's people's lives that are on the line. There are people who are in hospitals still suffering from COVID-19. There are folks out there that, even though the vaccine's available, it's a bittersweet moment. They've lost loved ones. So that's not lost on me, that this is extremely important and that everybody needs to do a better job, everybody involved in getting that vaccine out. Not just us in my division, but obviously the folks at the local level the ones, actually putting shots in arms. So it's going to get better. Everyone wants to get to the end of this, and I know that's kind of what some of the anxiety is. It's finally here, and everyone wants a shot. But look, even Dr. Fauci said this is going to take a long period of time, and so this will get smoother, shortly.
We hope you're right, and we are counting on you and your staff to help make it right. Jared Moskowitz, always good to speak with you. Thanks for your time this morning.
You got it, Michael. We'll be there for Floridians.
I know you will. Thanks.